So I'm a veterinarian and I'm an epidemiologist, and I've been working at WHO in public health for over 10 years, and primarily on zoonotic diseases, and much of my work has been focused on risk assessment. When I came to WHO in 2006, so one of the first things that we did was establish a routine mechanism for doing standard risk assessment for zoonotic influenza. And this was the time of H5N1, and there were a lot of cases in a lot of countries and a lot of questions. One of the things that we found with doing the risk assessment was, of course, we needed the animal health data. So we developed a way to collect and establish standard data from the animal health that we would use for our risk assessment, our public health risk assessment. What we weren't able to do was to actually establish a mechanism for routine assessment in collaboration with our animal health partners. That was something we tried several times with H5 as well as H7 influenza, and we were never able to get a process down where we would come to some agreement. And so now much of my work is focused on trying to develop standard processes and standard mechanisms for doing joint assessments. So working with our animal health partners in OIE and FAO to do risk assessments for emerging health threats or current health threats at the interface in a standardized way where we agree on the process and agree on the outcome at the headquarters level for global risks, but also developing tools and processes for countries to use, for ministers who want to work together, who have a shared health problem, so that they can have a standard process to come together and do an assessment together and come up with joint management options and joint communication options that they agree on. So the process that we've been using for zoonotic influenza and for other zoonotic disease risk assessments has evolved and developed over the years. And now it's very strongly based on the WHO Rapid Risk Assessment Guidance that was released in 2012, where we base the risk assessment on what we call risk questions. And we evaluate exposure, we evaluate the hazard, and we very much evaluate the context in which the event is happening. We also assign a likelihood, an impact, and an uncertainty for each of our risk estimates for each of our risk questions. And we've also, very importantly, provided justification for each of our risk estimates for each of our risk questions. Mostly for our zoonotic influenza risk assessments, we also post a summary of our risk assessment on the web. We have been doing this for influenza now for very many years, and this is a standardized process now, and every month a summary is posted on the web for zoonotic influenza that provides an assessment for each of the influenza viruses that's circulating, either in animals that pose a risk or for humans that have already been infected with a subtype. Another thing that's very important about these risk assessments, not only do we come up with some kind of estimate of risk, but going through the risk assessment process allows us to identify data gaps. Very, very often with these events, especially at the beginning, there are huge gaps in our knowledge. We have no information on surveillance and distribution of the virus, or sometimes even what specific subtype this virus is. And we recognize that to do a risk assessment, we don't need all of the information right then and there, but identifying what we do need to make a better risk assessment, a better estimate with less uncertainty will be optimal. And we do risk assessments, as I said, every month for zoonotic influenza, so we can gather the information during the month and then use it for the next iteration to have a better assessment. Sure. Formulation of risk questions is really critical to doing a good and effective risk assessment, because if you formulate the risk questions appropriately, it allows you to target an action, a practical outcome for the risk assessment. So for example, a good risk question, a targeted risk question would be, what is the likelihood and impact of a healthcare worker becoming infected with H7N9 influenza virus in China in the next 4 weeks? Such a risk question, if you evaluate the likelihood and impact of that situation, would allow you potentially to target surveillance to health workers, or to not target surveillance to health workers, or to target communications to hospitals to have them be more alert to potentially infected healthcare workers. So it really allows you to either put emphasis on that question or to not worry so much about that question. And if you have a variety of risk questions that cover the scope of your public health system or your human-animal interface system, it can allow you really to target your communications and management after the risk assessment based on the estimates. So what we like to see in a risk question, one, it's targeted to some outcome, that it includes both likelihood and impact. We always want to do an estimation of likelihood as well as an estimation of impact, and to associate an uncertainty with those estimates. The risk question should also specify the population affected. So we're talking about healthcare workers, we're talking about live animal market workers, we're talking about households who have poultry, for example. We want to specify the thing that happens healthcare workers are infected with. We want to specify the hazard, and we don't usually put in two hazards, so it's going to be influenza H7N9, or it's going to be rabies virus, or it's going to be Rift Valley fever. It's not going to be a mix of hazards. It's going to be there's going to be a time frame, so within the next 4 weeks, or during this outbreak, or ever, or tomorrow. And it's going to have a location, so in the area where the outbreak is occurring, in areas where the outbreak is not occurring, in a neighboring country, in a distant country. But it allows us really to target our messages and our management. We also don't assign scores or numbers to our risk estimates. We feel that assigning scores and using numbers is too easily misinterpreted, or these numbers can be used incorrectly by people who don't really understand the basics of qualitative risk assessments. So we use words to describe the risks, such as moderate risk or high risk or negligible risk, or high impact. And then we use additional words to justify what exactly that means. But we wouldn't say a risk is 10 and another risk is 3, because that doesn't appropriately describe the levels of risk. So one of the main challenges right now in the area of risk assessments in health, I think, is that there are so many different processes. So people are using different processes for doing risk assessments for trade in animals, for example, based on the OIE guidance. There are risk assessment processes for chemicals in food, for example. And also there are some for prediction of where a disease may emerge. For infectious diseases, there's also different outcomes, and the different processes are used for different objectives, for different risk assessments, to develop targeted surveillance, to determine preparedness or management or communication options. And because historically the human health sector and the animal health sector have had very different reasons for doing risk assessment, the processes that the human health sector and the animal health sector have developed and evolved have been quite different. And now coming together to do assessments together, there are just some differences in processes. There are differences in terminology, how we use the words. We use the same words, but sometimes we mean different things, and that can be confusing. In most cases, we have the same objectives. We have the same ideas on what risk assessment means. but we are still working to figure out what are the steps, the crucial steps, and how can we compromise so that we can come out with a single process that we both agree on. Another thing that we very much agree on, however, is that there actually have to be 3 risk assessments for every zoonotic event. Because public health interests vary very differently, significantly from animal health interests in many cases, the number of hospital beds you need for an avian influenza outbreak or a pandemic is a question animal health really can't help us with. And animal health may be very interested in trade barriers and what is the risk to trade from some particular hazard. And those things are different, and we may need different processes to assess those different risks from the human health sector and the animal health sector. But there's a place in the middle. There are risk questions in management and communication in the middle that we really need to do together. And so we need to develop processes, a joint process where we can agree on the terminology and the steps and the outcome for those issues at the human-animal interface. So WHO is working really hard at the interface right now to try and solve some of these problems. We're working in 2 ways. The first is at the global level with OIE and FAO partners through our collaborative mechanisms to develop a risk assessment process for triaging events, emerging events, and also for doing iterative risk assessments for existing events or re-emerging events like Rift Valley fever or influenza. And we're developing a process that integrates in both of our systems so that when we come up with an issue that one or us or all of us are concerned with, then we can come together and do a risk assessment. So we're working on the processes, we're working on tools, we're working on the communication and dissemination mechanisms at the international level. In parallel, we're working to develop a tool, a standard tool that has processes and the steps to do a risk assessment at the country level. So really the key message is for public health to really find an appropriate solution and good management and good communications about a zoonotic event, we really have to work with the animal health sector because they have data and they have management and they have communication, and if we are aligned, we would do a better job of solving the problem.